Kia ora nā talofalawa, bulavanaka, whakalofalahi atu, and warm Pacific greetings. As we know, currently there was a change to the alert level systems for Auckland and the rest of the country. We know that Auckland is now in alert level 3, and the rest of the country is in alert level 2, and that will be for the period of 7 days. And there has been quite a bit of conversations online. So we do this quite often, when we want to bring a sense of calm. We want to bring in Dr. Api Talemaitoga. Welcome, Dr. Api, and thank you very much for joining us for this COVID update. So welcome.
Thank you very much, Bulavinaka Johnson, kia ora, and welcome to your listeners.
So with Prepare Pacific, we have been noticing that there is anxiety again, there is confusion, and I would say there's a bit of anger out there in the community that we have gone into another lockdown again, especially for Auckland and our communities there. So can I just get from you a quick rundown of where we are at with the latest situation?
It is really unfortunate that we have had to go to level 3. In Auckland and level 2 for the rest of the country. We can argue that this could have been avoided if people had really followed and listened to the advice. Unfortunately, that didn't happen in this case, where we have a case who's been quite unwell for a while. And as you know, we've been telling people, if you're unwell, stay at home. Ring your doctor or health line and organize a test. I hope that the complacency that has happened and the lack of following advice is brought to the fore now, and people really take a look at what they're doing. This is the new normal that we have to live with, and we have to protect each other and the community by following the health advice.
Yeah, and there has been an update. One of those advice has been around locations of interest, and there has been updates put up this morning. I'm just looking at it now, and there's lots of these places that are on the Ministry of Health website where especially our Pacific people and our Polynesian people frequent. There's the likes of Hunters Plaza in Papatoetoe. There is the Pack and Save in Manukau. City Fitness in Papatoetoe as well as a new location of interest, and also the Manukau Institute of Technology, MIT Manukau campus. Now, it was previously reported that it was the Otara campus, but that was incorrect by the Ministry of Health. It is actually the Manukau campus. Now, Dr. Api, I just want to say, current testing messages is that we want people who have been in the locations of interest to get tested first. Why is it important that they go get tested first, not just anybody who has had symptoms? Why just the people of locations of interest first?
We want to give them priority because there is long queues at the testing centres. And we are worried that with this new variant, the UK variant that has been identified, that the virus tends to spread a bit more easily or it's easier to catch. So that means people who have been exposed in those areas as a possible casual contact are more at high risk of being exposed to this virus and becoming symptomatic with it. So it'll be good to get them tested first. Definitely the close contact. So if you're a family member, you should be self-isolating and getting tested and waiting for that result.
Yeah, we have gone on quite a bit around the definitions of close contact, casual contact, casual plus. Once again, can you just reiterate what those definitions are again, just for those that may have missed it?
Sure. And just to say that the Ministry of Health is clarifying this definition, so it'll be good to look at the website, but very straightforward to think of. Close contacts are those that you work beside, or you live in the same household. So it's a more than 15 minutes exposure inside a house, whether it's where you live or your workplace. A casual contact is someone you might have just met casually, meeting on the street, or, it's less than 15 minutes. It's a very cursory contact. Then you've got the casual plus contacts, which are those who have been to those places of interest at around the same time when the person was there. Now, in this case, it's really difficult because the Manukau Institute of Technology was over 3 or 4 days. So there will be a lot of people who will be casual plus contacts who need to get tested and need to wait isolating at home until their results come through.
That's one key point that I want to touch on as well, Dr. Api. We know in the latest case, in terms of case M, went to go get tested and then went to the gym afterwards. Can I ask though, why is it important that once you go get tested, that you need to go home and self-isolate?
Yeah. So once you get tested, it takes about 24 hours to get the results. During that time, you are still infectious. And we know from case M, who was possibly infectious for 3 or 4 days, even before the test. So just because you have a test doesn't mean, oh, I'm fine now. You really need to isolate yourself until you get the all clear. And in this case, it wasn't. And so unfortunately, all those people at the gym, at the pharmacy that he went to, and at the plaza were exposed when that could have been avoided if he went straight home, isolating and waiting for the result.
Yeah, so that's some key information there. Make sure you go home and isolate and wait for your test results. I just wanted to jump in here quickly and say that yes, Auckland is going into a level 3 lockdown in terms of, make sure if you can work from home, please work from home. But also I know that there are probably a lot of welfare needs out there at this time too. And we encourage people that if you are in need of some welfare support, to please get in touch with MSD, with the Ministry of Social Development. There are some details online. We'll put them in the comment section here as well for people to contact their 0800 number. And I believe there's some extra support being moved there as well. But before we wrap up with you, Dr. Api, I just want to reiterate around some of those golden rules that we need to make sure we're across. And it's still vital, it is still important that we stick to those golden rules. And they are?
They are good hand washing, coughing into our elbows, and maintaining social distancing. So when you go out, consider wearing a mask, especially with these new variants that are much easier to catch. When you go out, it's not a bad thing to have your telephone handy to scan those QR codes. That's how the health authorities can track and trace where you've been and make sure that the contacts are notified should a positive case arise. And the final thing, Johnson, like we've been saying along, and I wish case M had followed this advice, if you're unwell, stay at home. Better to call your doctor or Healthline than organize a test. Don't go to work. Don't go to MIT. Don't go into the mall. You are just putting yourself, your family, and the rest of the community at risk.
Yeah, and I know, there's families that are going to have to be arranging some extra care around school and stuff. But remember, schools, you got to stay home. Schools will be closed, especially in Auckland as well. And we just also want to reiterate that just be kind to the health workers, because even on Healthline, we are seeing that there are some long waits as well on the phone line. But we just please be patient, please be kind, and if you are going to get tested, and just be kind to our frontline health workers getting the test. Any last words, Dr. Api?
No, thank you very much for helping us disseminate these messages to our community.